Alright, so medications that can cause weight loss. First off, we have, of course, stimulants like methylphenidate, Adderall, meth, coke, stuff like that. And then we have stimulatory medications like bupropion, sometimes venlafaxine at higher doses, diethylpropion, phendimetrazine, pseudoephedrine, and ephedrine I would classify also as stimulatory medications. All those can cause weight loss. Another medication is naltrexone. It's an opioid receptor blocker, has its usage in alcohol and opioid use disorder. It decreases cravings for that, but it also decreases cravings for food. It's in a combo drug called Contrave with bupropion, which is interesting. Another medication is topiramate, Topamax. It's used for seizure disorder sometimes, and then also for migraine prophylaxis or prevention. It's in a drug called Fusemia with phentermine. So, of course, it's a controlled substance because of the phentermine. We have zonisamide as well. It's another miscellaneous seizure med that can cause weight loss. I'll talk about orlistat a little bit. It's a lipase inhibitor, so it inhibits the breakdown of fats. It's kind of a gross medication. Xenacol is the RX or prescription name for it, and Ali over the counter is orlistat. But it can cause some fatty stools, some oils coming out, and then flatus with discharge or sharding. So I don't know if I'd recommend that medication, but long term it doesn't really cause a lot of weight loss either. So that's something to mention. Another med class are GLP-1 RAs or glucagon-like peptide receptor agonists. Of course, we have Ozempic, Trulicity, Byetta, Victoza. And then we have the Wegovy, of course, and then Mounjaro. These medications are used for diabetes, and then a couple of them, I guess, have weight loss indications, being the Wegovy and the Saxenda. And then Mounjaro is about to get a weight loss approval too. So GLP-1s have been causing a lot of weight loss. So they're really good medications for that, but you got to be careful. Make sure you're eating enough and make sure getting adequate nutrition, and then that you're not just vomiting and not eating. That's not very good for you. So some of the medications are levothyroxine and liothyronine. That can cause some weight loss. We got SGLT2 inhibitors, which are like Jardiance and Farxiga. They inhibit the reuptake of sugar. It's for diabetes, but can cause some weight loss too. I'll mention loops too, or loop diuretics, like your torsemide, your furosemide. It's mostly water loss. Roflumilast is another one that not a lot of patients are on for COPD exacerbations. Acetylcholinesterase inhibitors can cause weight loss, like donepezil and rivastigmine. This is for Alzheimer's disease. It's likely due to the nausea, vomiting, diarrhea, GI side effects. I'll mention interferons too. They're not used very often, like alpha 2 beta. They have pretty gnarly side effect profile: fatigue, flu-like symptoms, myalgia, sometimes used for certain cancers, and then for Hep B and C sometimes. Not used very often. And then I'll mention some disease states like celiac disease, Addison's disease, Graves, cancer, late-stage HIV or AIDS, lupus, GERD, peptic ulcer disease, tuberculosis, and then cystic fibrosis due to malabsorption.